I'm going to label this case, Where's the Canine? But there's definitely a lot more going on with regards to chipping, flared out teeth, different proportions of the smile. So let's get right into it and go through the entirety of the case. So the reason I'm calling it Where's the Canine is because where is this canine? Because we know this is a canine and it's supposed to be a very prominent tooth in the mouth, but in this case, the one on the left-hand side happens to be tucked away inside behind the front lateral and the premolar, which is a strange position for it to be, but honestly, that's how teeth are, and sometimes, you know, you either have to move them orthodontically or you have to use porcelain veneers to create the illusion that they are somewhere else. So a few things in this case that I want to address is color. Patient doesn't like the color of her gray teeth. As we know, darker gray teeth do not bleach well. That's just the unfortunate aspect of teeth. These angles of the premolars back here are forward angling out, where really they should be kind of angling in towards the smile. These are all chipped in the front and smaller. It looks like square off teeth, not feminine like the ones that we would like. And also, as usual, we want to make sure that the architecture of the smile follows the position of the lower lip. So those are the few things that I'm noticing right off the bat. So if we look at it from the side as well, there's the teeth being chipped and worn. Why is that? Because she's a grinder. So what do we have to do? We have to educate. We have to make sure that when she receives the veneers, we always wear a retainer or night guard to protect the investment. And then this tooth is the canine, as I mentioned. What is going on with it right there? How am I going to bring that out? That's really the main focus, is how to bring it out, how much to bring it out, and then how to put the entire smile together. So if we look at this with retracted lips, and now we just focus on that, check out the angulation of this tooth, look at how small these are and where this is. So if I'm going to draw for you where my vision for this smile is actually to build this tooth so that it's more like this, right? This canine so that it's more like this premolar, this lateral, I mean, that is right here. These centrals are going to become longer. All right, that's going to happen here. Then this canine is going to be built out more and sort of like that. And so the laterals will now flow with the canines as well. And this premolar will be here. So if we look at this schematic, this sketch, basically this is where my goal and end vision is. And so from this 20-second schematic, I'm now able to prep the whole case. I'm going to show you how I prep half the smile compared to the other side, and then what the entire preparation looks like. So keep this photo in mind as we move on to the next one. So this side right here is prepped. You're like, wait, how's that prepped? That's the same length as the tooth right next to it. It is, but let's go back. Because we are increasing length, I don't have to shave the edge of that tooth. What I did have to do is just create a little bit of a peak up here by the tissue, because even though she doesn't show that, where my ceramist starts to have to build the porcelain is really important to try to make things look symmetrical, even if it's about a millimeter difference. So this preparation is extremely minimal. Basically what I'm doing is creating the outline for the veneer to slip on and over, and we know we're building out, and so not having to go shorter in the preparations, now I am able to build that case more. And what you can see is I actually prepped this case too, and I peaked the tissue because I really want to exaggerate how that canine comes out. And so I prepped this case basically from behind, because if you think about it, I'm going to be adding porcelain on top. So from behind is where the preparation is so that the veneer can slip on this way. So that's going to basically be the entire preparation of that tooth as well. And so if we're going to jump to the entire preparation, here is the entire preparation of the case. You can see now how little of that tooth needed to be prepped. And those are the top 10 veneers prepped in this entire case. How minimal? Yes. basically all these imperfections of the tooth, the colors that were there originally are still there, because all of this is going to be covered by a veneer. And so if we look at this from the underside, now if we look at a normal canine position here, so that the veneer is essentially going to come over this way, this one I had to prep a little bit from the lingual so that we can create an arch form. And what that arch form does is it allows the thickness of the veneers to be in the same position, so that the layering of the porcelain is even and that the color distribution among the entire smile is even. Think about all of those three things that I just said. So rewind and then go over it again. And here's the final case. So can you tell which canine was hidden? I believe the answer is no. And so here is that canine that we designed here. And then this is the smile positioning of those upper teeth. Look how we created individual teeth having length, creating beautiful symmetry, angulations. Everything that I talked about when I was analyzing the case is exactly how we created the final outcome, so that the porcelain can be even thickness, so that the lengths can be ideal, and so that we can create a long span smile that is protected, because we know the exact amount of porcelain that we need. And so here's the final case, right? These are the veneers on the right side. And then here's where we peaked that canine that was tucked behind. I peaked it a little bit at the tissue, but look how healthy everything looks, right? And if we look at it from underneath as we analyzed it previously, this is that same arch form that my goal was to create. And in order to do so, I didn't have to shave much on this tooth at all in order to have even thickness of porcelain, even though it was tucked behind in the smile. This is where we started. Remember, this one was sticking out. These ones were shorter. This canine was hidden. And so in order to mask the imperfection of this smile, we have now built a balanced, beautiful, gorgeous, healthy, natural looking smile that will last so many years and so much joy for her.